Hello and welcome to WASH Talks, organized as part of the biannual steering committee of the Water Supply and Sanitation Collaborative Council. My name is Eileen Palmer, and today we are interviewing dedicated WSSCC members and experts in the field. I'm pleased to have with me Kellyanne Naylor, who's the Associate Director of UNICEF under the WASH program, and also Bruce Gordon as the Coordinator for WASH for the World Health Organization. Welcome to you both, and thank you for coming on WASH Talks.
Great. Thanks for inviting us.
Kelly, over to you. I'd like to ask you about the importance of this year's World Toilet Day on November 19th, next Tuesday. Any special message you would like to highlight?
Great. Yeah, well, we're really lucky because the overall theme for this year's World Toilet Day is, of course, leaving no one behind. And this is, I think, really the theme of the Sustainable Development Goals. It's really about how do we kind of move the sector ahead as a whole, but also really look at making sure that we close the gaps on inequalities. And so I think this is really the messages that we're trying to highlight for World Toilet Day across all of the UNICEF colleagues in the field who are working together in their countries on local events. And we're going to be working together with UN Water at the UN headquarters. And there's going to be an event that's hosted by Singapore, India, and Nigeria, really looking at how we can better use the UN platforms to be making sure that sanitation features in the Sustainable Development Agenda in upcoming reports. And we'll also have a giant inflatable toilet. So stay tuned and please tweet our gigantic toilet in front of the UN.
Perfect. That's fantastic. Over to you, Bruce. The same sort of question about, as Kellyanne mentioned, that this year's theme is Leave No One Behind, Toilets for All. Can you tell us how your team and WHO has contributed to this theme?
Well, we're also excited about it. And actually, we've taken a kind of a specific little twist on it this year, which is really looking at focusing in on sanitation workers. So we are launched a joint report with ILO, WaterAid, and the World Bank, and it's about really looking at a group of people that are arguably the most marginalized, that are doing actually an incredible public health service by, emptying pits, by removing excreta, operating treatment plants, everything along that kind of line of dealing with excreta. But I mean, we're concerned because they're sort of by doing that service, they're putting themselves at risk. There just isn't safeguards in many countries, and I think millions of them are actually at risk of getting sick, and many have died. So we're trying to shine a spotlight on that, and trying to offer a little bit of, I guess, sort of inspiration to countries to try to better regulate, better make policies, and better protect these really, I would say, vulnerable people that are doing something that really needs to be done, and so their work isn't needing to be done at night in an invisible fashion. There's no sort of embarrassment with it. So yeah, we hope people will take that message. Actually, and by the way, there's a nice photo exhibition that's being showed at the Palais, and I believe online as well, showing some of the stories of these people.
Mm-hmm. No, that's true. I mean, sanitation workers look after the health of us all. They should equally have these rights.
Yeah.
Moving over to another question for you, Kellyanne. So WHO launched the the Progress on Drinking Water, Sanitation and Hygiene this year. A special focus on inequalities. Can you give us a screenshot or headline shot of the importance of this document?
Great. Yeah, thanks so much. So these update reports that are produced every 2 years really look at kind of the progress in countries, as well as then kind of projecting both the regional and global, estimates on household access to water, sanitation, and hygiene. And so this is the first one that has been the first update report since the SDG baseline report that was launched 2 years ago. So this was the first kind of dot on the map of SDG progress. And I think, that it was really dedicated to looking at inequalities. There's much more data that's available now. And I think that was really a theme of the report, is that we're able to get a much clearer view about who has been left behind, whether it's in urban or rural areas, predominantly, of course, rural areas, populations are being more systematically left behind. Looking also at between wealth quintiles, the differences in access between the wealthiest and the poorest populations, and then looking also across sub-national levels and being able to kind of see the difference between, for example, a capital city as opposed to a more distant geographic area. And so I think this is really helping us to get a much more clear, more granularity, clear picture of how we can be using public policy, how we can be using financing to really close these gaps. But of course, these are just snapshots. And then, of course, those estimates need to then be used by countries in order to inform their action. So I think if I had to say that kind of one kind of takeaway message is that while we've been able to present the inequalities, closing those gaps will really require deliberate action to be able to see progress.
Yeah, just did you want to continue with that or add to that?
I'll add after.
You'll add after that. Well, timely, because I wanted to talk about the global analysis and assessment of sanitation and drinking water, the GLASS report, launched at Stockholm World Water Week this year. And you're now at a phase where you're traveling around the world, talking about implementation, talking about this report, but also TrackFin. For those of you that aren't aware, TrackFin is for a methodology for tracking finances on water, sanitation, and hygiene at the national and regional level. So can you tell us how partners in Africa and Asia can benefit from these publications?
Well, actually, I mean, and just getting back to what Kelly was saying, I think one real sort of benefit of the JMP report and of the GLASS report is I think people use it as a tool. So it's the figures are there and are available to be able to sort of say, look, like they're, to call governments to account when needed, to be able to bring other partners in as needed. And I guess what I mean by that is if we have some of this, so the big information about coverage or about where people are being left behind, I mean that being able to talk in one voice to a group of concerned stakeholders, I think is important. So that's the point of departure. And then I think on the TrackFin work in particular, obviously understanding where finance is going, where the funding is going, and calling that out, because in many cases it isn't going where it's most needed. We do know that it's often expensive and there's disincentives to reach those that are in, like you said, in remote communities, and to deal with really difficult issues like marginalized people. These are tough discussions to be had, and so if you can kind of do it with an evidence base from organizations like UNICEF and WHO and sort of say, look, this is really credible data that is sort of at the highest standard. And it's telling us that there's inadequacies, huge inadequacies in funding, that policies aren't being implemented, and that coverage is low. That's your tool to be able to, I think, affect change. That's a big leverage point. So we're excited, I think, about partners being able to use and access that data and have a kind of a common metric that we have all bought into. These are the sort of almost key performance indicators for the sector, and if we're failing, we can kind of consolidate around that and to get to work again.
Yeah, elevate that importance.
Elevate it, absolutely.
Exactly. You mentioned a bit about partnerships, and I'd like to ask you, Kelly, what kind of complementarity, do you see between WHO, UNICEF, WSSCC? And what kind of support can WSSCC provide?
Great, thanks so much. And I think, we're all members, of course, of the UN family, and I think, it is really important that we're looking about how our actions are complementary and really amplify the human right to water and to sanitation, which of course have been recognized by the UN. And with the anniversaries coming up, I think it's kind of a good marker for us to kind of see how it is that we can strengthen our partnerships to be able to raise visibility within the sector, because I think we're all organizations that have kind of this global presence. So how do we kind of how can we better use that global presence to be shaping that narrative? But then we also are all organizations that have on the ground presence. So we also have that opportunity to kind of demonstrate results and impact on the ground. So I think, that we can be kind of using those levers, each kind of with our different angles, to be able to move the sector forward, both, as a global good, but also as a on the ground reality for people around the world. Yes.
Fantastic. Thanks. And over to you, Bruce, sort of same question for you, the common threads that UNICEF, WHO, WSSCC, and how can we enhance our partnership?
Well, I mean, there are, I think, specifics, but I agree, with Kelly, that collectively we're stronger together. I've always said this partnership we have with UNICEF around monitoring and around, kind of implementation of norms, we share that now with WSSCC. And that, as we just talked about, that's tremendous leverage. But I think some specifics around exciting work that we're doing is the work around the stuff we're doing in institutions, so WASH in schools and healthcare facilities. I mean, that really links with the Leave No One Behind, I think, theme. In a healthcare facility, obviously, many of the most vulnerable people are there, and obviously young children are vulnerable. So those, I mean, we're excited that those are, I think, on the agenda. And I think it's also worth saying that just some of the, I guess, synergies in terms of our work. I mean, WHO is kind of known to be the norms, setting standards, and we do some of that with UNICEF, but UNICEF has a bit of a, like the council, has a bit of a stronger presence in countries, and so we're able to, I think, extend the use of some of these standards that we've set forth. So I think there's a lot of synergies to working together, and it's only getting more exciting because I think as a sector, it is a complex sector. There's a lot of fragmentation, and the more we can bring it together, and the more we can kind of, work together, the better. I mean, and that's why we're here, and this has been a great opportunity here at the steering committee to just talk about some of the big issues.
Right. No. Well, thank you both, and thank you for your contribution over the coming days for our steering committee.
Great. Thank you.